Welcome back. The fight against coronavirus has entered a very crucial phase. Prime Minister Narendra Modi has appealed to Indians to observe Janata Curfew on Sunday. Janata Curfew means stay indoors. Do not come out of your house. Do not interact with people face to face unless very necessary. Politics has erupted over this. While some have hailed it, others have said that these are half measures. What about a special economic package? How about a special package for daily workers? Let's take a look at this report.
With coronavirus pandemic entering a crucial phase in India, amid apprehension of community spread, Prime Minister Narendra Modi announced a series of measures in his address to the nation, including a Janata Curfew or a self-isolation for a day on Sunday.
जनता कर्फ्यू जनता कर्फ्यू यानी जनता के लिए जनता द्वारा खुद पर लगाया गया कर्फ्यू 22 मार्च रविवार को सुबह 7 बजे से रात 9 बजे तक सभी देशवासियों को जनता कर्फ्यू का पालन करना है.
Maharashtra and Delhi followed up with announcing closure of malls and marketplaces. However, essential services like hospitals, medical stores and grocery stores will remain open. In Maharashtra, market restrictions will be in place in Mumbai, Pune, Pimpri-Chinchwad and Nagpur. Several Congress leaders including Kapil Sibal, Shashi Tharoor and P. Chidambaram spoke about the Janata Curfew. Shashi Tharoor said that he welcomed the call for solidarity and hoped Parliament would be suspended and specific economic relief measures would be announced.
I think the Prime Minister was testing the waters. I think he will be compelled to come back in a few days to announce tougher social and economic measures.
TMC leader Derek O'Brien took to Twitter to ask when Parliament is in session, should the Prime Minister not have made a statement in the temple of democracy? He also asked if they would hear more about short and medium-term solutions, preventive measures, augmentation of screening facilities.
There might be varied political views on Prime Minister Narendra Modi's call for a Janata Curfew. However, there seems to be a general consensus that one day's restriction on movement will be helpful. And also, the Union Health Ministry has now said that one day's cooperation will go a long way in ensuring that the chain of transmission of the virus is broken. With camera person Sadanand Tiwari, Abhishek Bhalla in New Delhi for India Today.
So you've heard the political leaders, but what about the common man on the street? How is the common person reacting to Prime Minister's appeal for a Janata Curfew? Let's listen in.
We're on Sunday going to support all those doctors and nurses and healthcare groups who are helping us contain this virus. I really like the fact that we're going to be doing that. And I also want to say that I don't mind doing this Janata Curfew over and over again until we are clear of this virus. Thank you.
Hi, this is Gokulia from Chennai. I saw Prime Minister Modi's speech last night. I thought it had universal appeal, if no new information or specifics. I wish he could have mentioned a little more about the economic stimulus package to follow. Social distancing is not a problem for me. I am a writer and I don't really have to interact with other people that much. And in regards to the gathering itself at 5 o'clock, I am cynically optimistic in that I'll be at my balcony waiting for someone else to start the clapping. Yeah, that's it. Thank you.
हमारे लिए जो ये कॉन्सेप्ट दिया है बहुत ही बढ़िया है और हम चाहे किसी भी कम्युनिटी को या किसी भी चीज को हम अगर हम बिलोंग करने वाले हैं लेकिन हमें इस चीज में हमें साथ देना चाहिए उनका क्योंकि उससे ज्यादा फायदा हमारी जो आम जनता है जिनको सारी चीजें मुहैया नहीं है उनको फायदा मिलेगा इस चीज से.
Is this Janata Curfew going to be effective or are these just half measures? Joining me on the show, Anil Singh is the spokesperson of the Bharatiya Janata Party. Rajiv Desai is the political analyst who will give us the Congress's perspective. I also have with us as our expert, Dr. Anil Handu, Senior Consultant Hematology and Director Laboratory Services of the Kapoor Hospital. Dr. B.L. Kapoor Hospital joins us on the broadcast. But I want to come to you first, Mr. Desai. what do you make of these measures? A Janata curfew. Will it work? Is it effective?
Well, first of all, I do not represent the Congress perspective. That's number one. You ought to be very, very clear about that. I have absolutely nothing to do with the Congress. What I have to say is based
Fair
on
enough.
years of experience and so forth. Now, as far as the Janata curfew is concerned, I guess it's a gesture to underline the seriousness of the virus and the epidemic or the pandemic. But I don't see that it's going to break any chains or anything or do much in terms of handling the virus. I think things like testing and various other data collections, sampling people, all of those kinds of things are far more important in controlling and beating back the virus. You don't have to take anybody's word for it.
Let me
It's
then
already
take this to
happened
our
in China.
expert,
It's happening in
Dr. Anil
South
Handu.
Korea.
Dr. Anil Handu is a medical doctor, and let me get his perspective on this. Does Janata curfew work, Dr. Handu? Will it help break the chain?
So Gaurav, I would completely disagree with my predecessor on the fact that that Janata curfew has nothing to do with spread of the virus. It is very important to realize that at this point of time, despite testing and despite doing any other measures, we still do not have effective treatment available for coronavirus. So therefore, the best way to deal with coronavirus today is to avoid contact. That's pretty simple. How do you avoid contact? You don't meet each other. How you not meet each other? You stay indoors. How do you stay indoors? The government can enforce onto you, but that would be rather harsh. It is better for us to take precautions ourselves, stay home, and that's where Janata curfew will do very well. And I guess if this could be continued voluntarily by people further beyond the Sunday, that would be fantastic. It would surely reduce the possibilities of contact and would reduce the infections within the system.
Okay. Anila Singh, but the BJP must practice what the Prime Minister preaches. Apparently, there was a party in Lucknow where you have a BJP MP, a BJP former Chief Minister, and apparently the current Health Minister of Uttar Pradesh, who are now under self-quarantine because they did not practice the Janata curfew themselves.
Absolutely, Gaurav. They shouldn't have attended this party. Rather, they would have told people not to do any sort of get-together. Very clear advisory was given by the Prime Minister and as well as from other platforms, and all the electronic media, social media, print media, everywhere this thing is being continuously being told to the people that avoid gatherings. And when public representatives, they do such thing, that too from a ruling government, it is not appreciable at all. So definitely they shouldn't have attended the party. And secondly, I was listening to Mr. Rajiv Desai. I find such people to be very nagging, pessimist sort of.
Yes, but should this be optional or should this now be made mandatory, Mr. Desai, in your opinion? A curfew in Wuhan, a curfew was imposed in China, a curfew was imposed across multiple cities for over a fortnight to break the cycle, and it's only now that China is saying for 2 days not a single case has been reported. So should it be made mandatory, keeping people indoors for at least a fortnight, not just a day?
आप मेरा ले लो.
Okay, I'll take a moment to establish that link with Mr. Desai, but Dr. Handu, if I may bring this question to you, 1 day appears symbolic. Should it be made mandatory for a fortnight, at least a week or a fortnight? Will that help break the cycle?
Well, if that could happen, I would be the happiest man on the earth, because that is something which I would definitely want this country to go ahead with. self-curfew, ensuring everyone to stay home for maybe more, that would be the best that could happen. As you've rightly pointed out, the Wuhan part of it has clearly given us enough evidence to suggest that the moment you're going to break contact, you're going to get better. And you can see that from no new cases, within the Wuhan district itself. And now this is standing published in the New England Journal of Medicine as well, that this data is authentic and it's going to give us better information more and more by the passing days. So I would for sure agree with the concept of having Janata Curfew to continue maybe for 2 weeks.
Okay, for at least 2 weeks you say. Okay. Anila Singh, is this merely symbolic? What Prime Minister Narendra Modi said, ek din ka Janata Curfew, is this symbolic? Should it be there for at least a week, if not a fortnight?
See, people who want to take it as a symbolic curfew, they can take it. But it is a beginning, and it is a beginning for better thing, because we know it very well that if we go ahead with something like 1 week or 2 weeks or for a month, I think people are going to go into shock. That what is there? I mean, are we going to face something very disastrous? The only request which Prime Minister made yesterday was that for a day's time, at least try this curfew, be in your home, try this. So if the people, they are trying to find some sort of politics in it. It is very sad. It is a matter not of any political party, but of our country, of all the citizens living in our country. So the Prime Minister has to think from that point of view.
Should the government and should the Prime Minister not have announced measures? You can ask people to stay at home for 1 week. You can ask people to stay at home for a fortnight. लेकिन जो डेली मजदूर है वो खाएगा क्या? What will that man eat? Look at Justin Trudeau in Canada, Mr. Desai. He announced a number of measures. He said if you are home, the government will put some money in your account. If you are employed, the government will give some subsidy to your employer so that your employer does not sack you. Should some of these measures also have been announced by Prime Minister Modi?
That's what Mr. Trudeau said. That's what Mr. Trudeau said. That is what Mr. Modi, a speech like that should have been a reassuring speech, and a speech that conveys that the government has got its grip on the whole situation by telling us what are the steps they're taking to prevent the spread of the virus, how are they going to help the economic uncertainty, all of those things, not by just saying we're forming a task force. If you saw, not just Mr. Trudeau, but others have speeches also, they've been very clear and focused, and they've been very reassuring. This was not reassuring, and I'm not saying this in a critical frame of mind. I'm saying this in a frame of mind to help people. People faced with this incredible uncertainty are looking for some reassurances, are looking for some post to lean on, something to hang on to, and on that count,
perhaps reassurances were there, but concrete measures
address of the Prime Minister did not go far enough.
Yes.
It did not go far enough, is all I'm saying.
Will there be then a second phase after Sunday? That remains to be seen. Dr. Handu, Mr. Desai and Anila Singh, for the moment. Okay, Anila Singh, you want to come in quick, 30 seconds to you, madam, because concrete measures are needed at this point of time. So what about those daily wagers who you've said stay at home, but how will they eat, madam?
I appreciate your concern, and as well as Mr. Desai's concern, but I need to tell you here that what you are saying, Gaurav, or what Mr. Desai is saying right now, do you think that Prime Minister of our country doesn't understand that? A person who himself belongs to a very humble background, doesn't he understand this thing? Do you think he doesn't have any plans for that? I think we should not underestimate our Prime Minister. He knows.
Well, I would like to not just hear about those plans, but see them being implemented on ground, ma'am.
I want to convey here.
Fair enough. Fair enough, Dr. Handu, Mr. Desai and Ms. Anila Singh. For the moment, many thanks for joining me. I've run out of time on this part of the debate. A quick break on the other side.